This Health in Focus is a paid segment by Jagannathan Neurosurgery.
For today's Health in Focus, we are talking about compression fractures. We, of course, have Dr. Jagannathan, board-certified neurosurgeon of Jagannathan Neurosurgery. We've got Sherry Kempfer. She is from St. Helen to talk about her experience. So, first of all, Dr. J, tell us about compression fractures and what they are.
So compression fractures are fractures involving the spine, most commonly in the thoracic and lumbar region of the spine, and the two most common causes of them are basically osteoporosis, particularly in women after childbearing age, and cancer, which you see less commonly, but is also a source. And the reason for the fractures is because the bony architecture of the spine diminishes, either due to osteoporosis or due to other factors, and the vertebrae can fracture easily. Most of the time, these are stable fractures, meaning it's not going to paralyze somebody, but they can cause extreme amount of pain. And so there are some minimally invasive treatment options that we'll be talking about today.
Okay, so and show us here where this would happen. Where is this happening?
So basically, this is the spine over here, the thoracic and lumbar spine, or the bottom part below the neck. And most commonly you see it in those areas. Typically you see these types of fractures in junctional areas between the thoracic and the lumbar spine, for example T12 or L1, because those are the areas where the mobility of the spine in the thoracic region is kind of limited by the ribs, and then below that your hips and your spine tend to move a lot. So those are points where the bones, if they're weaker, tend to have more susceptibility to being fractured. But really, they can happen pretty much anywhere.
Okay, so tell us about some of the treatments and what a patient can do.
So the treatments, initial treatments are going to be things like rest and analgesics. Occasionally, you can use bracing. In cases where the pain isn't getting better or where it's severe, you can do a procedure called a vertebroplasty or a kyphoplasty. And what we do there is we inject a little needle in through the back of the vertebrae and blow up a balloon that expands the space where the bone is demineralized. And we inject some glue in there that helps stabilize the bone and helps with pain. So it can be a very effective treatment for pain, usually done as an outpatient, where you come in and have it done and go home the same day. Usually it's a one-time procedure, so you have it done and that's pretty much it.
You're good to go. Okay, so Sherry, this is what you had.
Yes.
So tell us a little bit about what your symptoms were like before we had this.
Well, I was having constant back pain, didn't know why. I went to my primary care doctor and they suggested that I see a neurosurgeon. Now, my husband was a patient here, so of course I came to Dr. Jagannathan, and we had an MRI done and it showed that I had a compression fracture on the L1.
Okay.
So he came in, had the surgery, everything went fine, I'm out of pain. I would just recommend him to anyone.
Yeah. So what was the procedure like for you?
Very easy. Everyone here was fine or nice, and they put me to sleep. I really don't know any more than that. I woke up and it was over, and
There you go.
Follow-up was fine, and I'm great.
You're good to go.
Good to go.
All right. Well, Sherry, thank you so much for sharing your story. We appreciate it.
You're welcome.
Dr. J, thank you so much. If you want to learn anything more about this procedure, about the symptoms, you can always head to our website, 9in10news.com.
This Health in Focus is a paid segment by Jagannathan Neurosurgery.